Pitt County last night, and if we have Dr. Wendy Graynard, she's going to join us. But I was in Pitt County last night because there's a family there. There's a couple of families there that are suing the school district because of these invasive panorama surveys. And so the surveys, when you look at them, Nancy and I, we've looked at them, lawyers have looked at them. They look like an intake form for mental health services. It's exactly like what you would see if you went to the doctor to be tested for, depression, even bipolar. There's not a blood test for these things. So in the psychology world, we have something called a diagnostic. It's a measuring instrument that you would measure psychological issues with. Well, we've got a couple of parents in Pitt County that have had these surveys given to their children without their permission. We've had a couple of parents who their parents have called and said, hey, the principal, hey, we don't want our kids to be given these surveys. The principal says, fine, ends up bringing the kids into the principal's office the next day and basically conned into taking it, the children. So you've got the principal coming in between the child and the parent and circumventing in a sneaky way what they want to do. And then last night, in talking to Pitt County School Board members, we also learned that the school board members themselves approved a certain type of questions on the survey, and that the state went around what the school board wanted and put their own questions on there. Because you have to remember, and now we're just learning that when these surveys are given, they're given to the child in classrooms on computers, right? So it's a direct line from the state DPI right into the child. Teachers don't know it a lot of times. Principals don't know it either, or maybe they do. And then school boards don't know it, right? Who knows it? Apparently, according to our records, the North Carolina Department of Instruction, they know it. And Nancy, we're also finding out that that now the DPI has requested around $40 million to put, in essence, mental health clinics into every school. That's what they want to do. So I told you with the surveys, we've got the instrument to measure psychological issues. We've got that. We've got the staff in place, the clinical staff to diagnose. Once you have a diagnostic, Nancy, you know this from being a doctor, you cannot read that diagnostic unless you're a clinical health professional. So if they've got that, right? Here's two things that you don't know that they have also. So the DPI has partnerships with clinicians who can write prescriptions, okay? And the age of consent for puberty blockers in North Carolina, antidepressants, antipsychotics, and I believe birth control pills or anything to treat drug addiction, guess what the age of consent is? 0. You do not need consent. Now, check this out. The North Carolina general statutes state that for only 2 classifications of things, right? It's anything really mental health related or pregnancy or prevention related, except for abortion. So someone at the NCDPI, someone somewhere a while back said, wow, we're going to put mental health clinics into schools because guess what? We can treat them. We can treat children without any parental consent. And that includes prescribing, potentially, and administering psychological drugs and puberty blockers. Does this ever happen? Yes, it does. In California, the interesting thing is the age of consent there, Nancy, is 12. And so when you're 12 and up, these clinics that are being set up, just like in North Carolina, these clinics are being run sometimes by Planned Parenthood officials, but puberty blockers are absolutely being given against parents' will and without them even knowing. We have a worse situation in North Carolina because the age of consent is 0. So it is conceivable that a 6-year-old would, I mean, I'm being maybe hyperbolic here, but let's say a 10-year-old would answer the question on their survey that they didn't know what gender they were. And at that point, a clinician can talk privately with them and treat them on a daily basis with puberty blockers without the parents knowing or consenting unless the child says so. Nancy, you're reading this stuff as well. What is your take on it?
Well, interestingly, coincidentally, while we're putting all this together, 60 Minutes did an episode, I think, on Sunday. I never watched 60 Minutes anymore. But I did come across it where they did a segment on transitioning and transgender issues and the ethical dilemmas surrounding that, as well as detransitioning, which I was even more surprised that they were willing to go there and broadcast it. And the brave individuals who talked about some of their issues with detransitioning. And it was very scary how little effort was required to get on these puberty blockers here in the US, how there is virtually no support. I mean, nothing. I mean, there's more support for total joint replacements, classes and things to make sure that that's appropriate than there was for these people. And it was really scary. And literally having surgeries, thinking that removing parts of their body would make them feel more like a real person, when actually they're suffering potentially from some other issue, either a depression or perhaps mixing up being transgender with being homosexual, these issues that really need to pan out over time. And then going into surgeries, finding doctors who are willing to do them and permanently changing their bodies and their physiology because of this. And so if you want to research that 60-minute segment, I think it just aired this Sunday. So yeah, I think it's very real. I think, we already have evidence of school boards making sure everyone is affirmed no matter what, just affirming, even if, just based on what the child says. And I don't know that that's a rational or reasonable approach. I think it should be a more neutral approach, a more team-based approach, and outside the school-based approach. I think the least capable people to affirm or to make these decisions are people involved with public schools. They're not physicians. There's so many issues already. These people need to be talking with parents and experienced counselors and physicians outside the school.
Right. And so that's right. I mean, a lot of times, people do regret having the surgery, but what we know from puberty blockers is it can cause suicide. Moreover, it can cause sterility.
And permanent changes, vocal changes, hormonal changes that cannot be reversed. That's exactly right. Yeah. And
so, and you're a doctor, and so you can kind of speak from experience what this would do. And so if you're just joining us, let me kind of recap this. So what we're finding is, let me just layer it on top. In North Carolina, there is no age of consent for puberty blockers at all whatsoever. That means that a doctor does not have to ask a parent if it's okay to administer those drugs. A doctor does not have to ask anyone but the child if they can administer antidepressants or antipsychotics or Ritalin for that matter. Okay, so that's the law. That's number one. And so there are now mental health professionals being installed in the schools. What do I mean? There are 3 current bills right now we're going to tell you about, and there's a budget request from NCDPI, a $60 million budget request in all for these services. Now, I find it curious that the age of consent is 0 if it is a mental health issue. These are mental health clinics. Nancy, you and I wouldn't have a hard time at all if we were sitting here talking about sports medicine clinics inside schools. I'm a firm believer of that, right? I mean,
there are many, in universities and that kind of thing.
Perfectly appropriate. But these things are being done, again, without consent. So we've got, you guys, it's legally allowed. We've got surveys are being done. Surveys are being done by Panorama, which is also what the DPI is asking money for. Surveys are being done, yes. And I want to tell you how the surveys are being done, Nancy, because I just found out last night. And I think we're going to have Wendy on here in a minute. The surveys are being done without the teacher knowing what they're asking, the principal knowing what they're asking sometimes, and the school board. The school board is saying, we don't want these particular questions. Doesn't matter. The kids are sitting in the classroom, getting the questions from DPI to that computer. Doesn't make a damn bit of difference what the school board says, number one. Number two, teachers don't know what the kids are being asked at all, right? And number three, we have confirmed incidents of the parent calling and saying, we do not want our child to take this survey The principal says, okay, fine, and then goes and strong arms the children into taking the surveys. What you have, Nancy, is government shrinks going into our schools with a captive audience and looking for patients. That's what this is.
Yeah, there's no need for any of this. Traditionally, you think of a nurse in a school as checking your temperature and calling the parent, or, you go there to lie down for a few hours. But this is scarier. And also under that Leandro request, there's requests for community schools in low income areas where you center health services too out of the school. And there are just so many ethical problems with this. And the fact that the government is going to take this over in those areas, and people won't have a choice, and parents won't be involved. And it boggles my mind. I don't understand. This is out of control. The Board of Education, NCDPI, and these legislators who are supporting these bills, they're out of control. They're not living in reality. This is
serious stuff. In fact,
it's a problem.
I think that this is the most serious talk we've ever had. And again, and I'm telling you this in all seriousness, I was so upset and so rattled. I overflowed the bathtub and completely crashed in my ceiling. I mean, I can laugh about it now. It was,
I'm sorry.
I know. No. I mean, now I can. By the way, my husband, he's still cussing. That's why the door's shut. But again, I mean, this is, in other words, Nancy, you and I have been doing this for a while. We've seen a lot of things. We talked to a lot of people. This is the most agitated we've ever been. So I'm going to try to bring on Wendy. Wendy is a parent in Pitt County. Wendy's actually a hero, very much so, because Wendy gave us the part of the puzzle that we did not know about. So I'm going to bring Wendy on. See, Wendy.
Hey.
Hi.
Can you hear me?
I can. I saw that your tech support, which was your son, probably 14 or so.
I can never do it on the laptop. I don't know what's wrong, but he got me on my phone. So, hey, how are you?
Good. So, Wendy, we want to pick it up from this. What I'm telling the audience is, I went to my meeting with you last night in Pitt County changed me. I thought that at the school board level, that the school board could intervene. Right. We learned from your lawyer that this is coming from the state, and we learned from actual board members in Pitt County that said, we forbade them to ask these questions, and the state did it anyway.
That is correct. So, just to give those viewers a background, I used to be a school administrator pre-K, and so that's kind of my background, and exceptional children. And as you well know, with IEPs, it's all about parents' rights and permission. And so I kind of grew up in a confidential world. And I believe, adults can go at it, but when you put children in the mix, then my head will spin, especially to protect them. And like Sloan said, I have never, ever seen anything like this in my life. I left administration and opened a developmental childcare center. And I left in 2012 or 13. And the people that I worked with that I'm now fighting against, I don't know what they're being driven by except an agenda. And we shouldn't, politics are not, children should not be in the mix. I mean, it's awful. So our son, our youngest is 13, and he got in the car and he said, we took a survey, and I'm not about conspiracy theories. I kind of just brush things off. I try to be peaceful. And he said, you're not going to believe we took a survey today. And I was like, well, I was I was in the first era, 2013, to push the social emotional stuff. Let's take breathing exercises. Let's look at the smile on our face. Let's take 5 minutes. I know there are a lot of mental health issues with children. And we started, with pre-K, and then worked our way up with kind of the social emotional character classes, if you will. But he said, and I'm very open-minded. I have gay friends. I have people that are transgenders.
By the way, Wendy, in our experience, when we have a lot of gay people in this movement, we have a lot of gay couples, married couples. I find they are the most vehemently opposed.
Yes.
Surveys.
Yes.
They do not like it.
That's right. And so, anyways, he said I had to, and it was a district-wide survey. And I was taught always to start at the bottom and work my way up. And so he got in the car and he said, "You're not going to believe the survey." And again, I have a 30-year-old all the way down to a 13-year-old. Have always been overly open with them, talking because I wasn't raised that way and things happen to me. And so, to me, you should be overly honest so they're talking to you. And he said, they asked, were you male, female, and if you're other, please explain how you identify. And then, but it came out of nowhere. And if you look at the survey, it, I understand anxiety with COVID, and, we want to watch for suicide rates and depression, that kind of thing. But it said, yes.
Wendy, I want to jump right in, because what it did was it said, are you male, female, other? And then, would you like to talk to someone about this? So that's the thing that we look at, is that, and I want everybody that's listening to understand that by law, if a child says I'm something else, okay, at that moment, you are going to be separated from your child completely. By law, they cannot tell you anything that happens inside of that school from that moment on.
And it asked for their, so initially I thought it was 6th through 12th graders. And the teacher, a kid asked, it asked their personal, what's your name, your telephone number, and your email address. Well, they have that in Power School. So I was thinking, why are they asking them that? And then, of course, I know parents' privacy. I know Title IX is for transgender. There's federal guidelines with that. There's EC, parents' rights. We sign off on anything confidential. Do they understand their rights? And I'm thinking, what? I almost ran the car into somebody. I was just in shock. And so, and like Sloan said, it said, please, they were leading questions. Wouldn't you say, Sloan, that, leading into, do you feel like you need to talk to somebody? And,
Wendy, what I saw, and I want everybody to know and understand a couple of things about this here. Number one, I believe that the one thing I will say is that this is kind of transparent. Like, we can show you where to look at this. We will show you. Wendy, you've been very transparent. You've done everything. But you guys, there were 3 different surveys, right? There was one that I kind of liked. I love the fact that they're asking, it's like a customer satisfaction survey.
Yeah.
Hey, do you like the environment? Do you like your teachers? Are you understanding it? Love it, love it, love it.
Developmentally appropriate. Perfect.
Totally. The second one was what we were looking at was a diagnostic tool that you would take in any type of mental health office. By the way, you don't give those, Wendy, unless you're going to interpret them by an expert and treat it with therapy or drugs.
And not with a psychologist who is the one that wrote the letter. These parents, yes. I questioned, first of all, I don't put stuff on Facebook and complain. I'm just not that kind of person. But I was like, hold on just a second. Did other people get a survey? And like I said, I don't usually do that. And I had questioned the school, like, whoa, on their registration forms at the beginning of the school year, I laughed with my husband because it said male, female, and other at the top right-hand corner. And I emailed the support services director, and I said, what in the world is other supposed to be? And I put on there, because I do have a sense of humor, I said, must feel like a kitty cat today. And of course the teacher laughed. And because that's an interpretation, you have EC kids who are developmentally delayed that get read aloud, and you're going to read this survey to them, and they're going to ask what other is, and you're going to have a teacher translate that.
Well, and there's another thing, Wendy. Yeah, I was just thinking about this. Look, I think any one of us that were in the 3rd grade, 4th grade, 5th grade, well, I can speak to my experience. I had a troubled background. And I was in foster care. Right. And so, in other words, you're very, I know this, you're highly suggestible.
Yes.
Right. So if you're getting, I can see that if you're getting lessons on, if you're questioning your identity, period. and you're being hammered day after day after day. But I want you parents to know that if that happens and you by chance just one time put your questioning or whatever it is, Wendy, they're asking you, you're done. Right. Your parental rights are over. They're over.
And Nancy, part of it too, Nancy, was I had sent a professional email, and I sent it to because a principal that I still know the administrators, and I had reached out to his teacher, and she said, Wendy, we had no idea what was in this survey. And I said, it was a district-wide survey. I said, it means there's a grant, there's money coming. And so I was then texted by the support services director. She said, as a friend, will you please take down your post? And I said, as a professional, I need you to answer my email and I need a copy of that survey. This is not a friendly situation. And she did not respond. She didn't respond. The next day she responded. She said, I was in the middle of an interview, interviewing administrators. And granted, people had reached out to me about 3 or 4 weeks before that. Did I want to come back as an administrator? And I don't think they're going to want me anymore. But anyways.
Tell us about getting a lawyer involved, because Wendy,
So I'm not, we flip houses and we have some businesses, and I opened a developmental daycare, sold it. And so I have a business attorney, and I was in the gym and I talked to him and I said, I want to ask you about something. And his face was like, what? So I said, I said, they're ignoring me. And her response at support services, a letter went out. This is her excuse though. She said, that was only supposed to go to the virtual students. And I said, well, that's even worse because they're at home by themselves, most of them. So anyways, it accidentally went out to every single kid. But let's just say that my child is, and Sloan, I will be transparent here. I was molested as a child, raped as an adult, and these kids are very, very vulnerable. So, and I joke with my husband, like, if, I could have been like, gee, am I supposed to be a male or female? I hate men kind of thing.
It happened I want everyone to know that it's easy. This is, in psychology, which is my background, Wendy, and I think you've got training as well. I mean, we all three of us have training. So we know that, suggestibility from an authority figure is so prevalent, even if you're a healthy person. I mean, there's something called brainwashing. Yeah. We understand what it is. Now, most teachers are good-hearted, would never do something like that. We are hearing about more and more teachers who are doing things like that. And then you give them this test. And look, we remember No Child Left Behind, where there was scandal after scandal after scandal with teachers changing tests.
Yes.
So what if, and look, we're saying what if, because this is the most dangerous thing I think the three of us who are experienced.
I have never seen anything ever. That's right. And so I went to my lawyer and I had everything because my late husband was also in administration, and I remember him saying, if you don't write it down, even when I did teacher trainings, when we're sitting with a parent, you always listen to a parent and you acknowledge them, even if you don't have the answer. But you always have documentation, because if you didn't write it down, it never happened. I will listen to your complaint from a teacher, but unless everything's data driven. And like I said to Sloan last night, there is no data being collected. It's subjective of their answers. Right. You're making a judgment call, and we have no psychiatrist on staff with Pitt County Schools. So why are we collecting this information? And the lawyer said he sent a letter. Of course, you start out peaceful. You send it. We didn't hear back from them for 2 weeks. And then their response was that we're sorry. Yes, we should have been more transparent. Even in their Board of Education policy, under surveys, it says that the parent should have been privy to the survey before and could opt out and needed to give parental permission. None of that happened. None of it. And at one school, at Hope Middle, we have a principal who was letting the kids opt out and then pulled them out of the library and is making them take these SEL classes and surveys. And I'm not one to make my child rebel, but we're now teaching my son, if you have a survey and you're not comfortable answering, you tell them, I'm sorry, but you need to call my parents right now. I'm not answering these questions. What?
Nancy, I mean.
Yeah, I just want to say, because I can't comment. There's a comment here about how someone had a survey where they were asked if they'd been sad 2 weeks in a row at any point. That's a DSM-4. Yeah. I haven't read the latest edition.
A DSM-5 now, right?
Yeah, for major depression disorder.
And they can medicate your child without you knowing about it, according to North Carolina law.
There is no reason for a school to be administering this.
So
it's very scary, and and even if they argue, like say, even if legislators argue, or the devil's advocate says, oh well, parents will make sure they give consent and blah blah blah. No. How many miscommunications happen in schools? In the public, I mean, right. The chances for this data being screwed up, lost, mixed up, parental consent not obtained, missed in an email, whatever. Why are they even? It's mind-boggling. They should not. This is not their jurisdiction at all.
The response that people have given to me is, well, just I was a single mom with I was 18 and pregnant, and so I have older boys and held 3 jobs. Now I've worked hard and I have money with the 13-year-old, and I'm remarried. But someone said, well, just take them out and put them in a private school. And I said, why? Like, what? We're creating self-contained, low-income, low-performing schools is what we're doing. And Sloan, you made a good point. Those people could be our child's boss, and we still have to work with them as we get older. It doesn't seclude us.
We were talking about this. I mean, Nancy and I have kids actually at the same private school, and folks will a lot of times say, "Look, it's not my problem. I'm taking my kids out to homeschool or whatever." First of all, in this country, we are America. We protect human rights across the globe. We have it right underneath our nose. It's our duty to protect human rights abuses. This is a human rights abuse for sure. Privacy, manipulation, psychological testing, I dare say experimentation. Mm-hmm. This is not something we allow. Number one. And number two, Wendy, as you said, who do you think is going to be running the country? The people that are in this system.
Mm-hmm. I mean, it's just, it just is. So Nancy, and Sloan, so a HIPAA violation doesn't supersede what's going on in the schools?
No, it won't.
Not anyone's violating. It's not the HIPAA violation is for
medical.
Yeah. I would have to look at, honestly, I've been away long enough. But my understanding was if it's like a physician who, texts out, oh, look at this person's X-ray.
Okay.
So I don't know what the privacy laws have with the school. Like, can the school sell that information, or that's the thing. You have no idea what's done.
My point was too. It was also that, and it was Sloan called me. I had shared it on Facebook, are other parents not concerned about this? And again, I don't have those kind of forums. I don't have time for that crap. But this really bothered me. And
it's wrong.
Right. And someone must have sent my letter, because I said, look, I'm reaching out to a lawyer, and whatever I write down, I'm pretty open. Like, I don't write it down unless I can share it. I won't talk behind Sloan's back. I will say it to your face kind of person. And especially if we're trying to make a difference, we don't need to be slamming each other. We need to get to the bottom of it. And so I just am blown away. And it was just, our superintendent said, yeah, we kind of went about it the wrong way. But then it was Sloan called me on a Friday at 5:22 that I said to my husband, holy crap.
While my bath was running.
I mean, I was just, I said, honey, we've done right, because again, I don't go sue people. And so we're not suing. We asked in our letter, we wanted them to acknowledge that they didn't ask parents. 2, that the parents were not given a copy of the survey. And 3, that the information that was received on the surveys would be shredded. And they didn't do that. And they admitted, Sloan, what you said, oh, I don't think it's federal money maybe or something. And then it turns out then then they pass the buck. Yeah, go to Washington and file a complaint. Okay, let me take my little lawyer and we'll do that. Okay.
Wendy, well, we learned something important, with you and last night. And I want to share this with everyone. And that is that there's a myth going around that the DPI and the State Board of Education, which Catherine Truitt admitted, they are one. So we look at them now as one instrument without any differentiation. That's the way she wants you to think of it. They do make policy, and here's how. If they're getting money, when we found out the money is coming from the CARES Act, this is before she came on board, by the way. So it is. But they got money from the CARES Act to do this stuff. When you have money coming in from the Fed, you do most certainly set policy. Right. And here we have a clear instance of where the school board tried to change it. They couldn't. The state was in control. The principal tried to change it. They couldn't.
Right.
The parent trying to change it. The state, let me rephrase it. The state government is turning your children into spies, and then your schools into a laboratory of psychological experiment. Those are the facts. The state, and Wendy, it bypasses what they're doing. This is insane.
And this is Nancy. The surveys too are scary because children are giving out information that's very private in their home that could open up a DSS
Tell us about
case.
That.
Yes.
Wendy, your children could be taken away. Nancy, you saw the surveys. These surveys mean that, let's say you went to the January 6th protest. Many people didn't like it. Some people did. Who are we to say? But if a government official does not like that, and I just saw a survey question that, have you thought about suicide or whatever? Someone doesn't like that. They can, based on that, take your children away from you.
Yeah.
Everyone needs to know. The state now can have the power to do that.
Right. Mm-hmm. It just is. I'm in awe, and so we are making a plan, Sloan. We were consumed with a ton of information because you're hyper like me, and just you're so passionate, and so. But we now have a plan, and we have people that know a little bit more about the government and how to. You're gonna get that survey the petition together. And then we're going to present it. And we had Sandy Smith there last night, who's very much in support. We had 2 board members, Nancy, that are so against this, but what was it? 2 against 5, Sloan? 2 board members.
They're being lied to, because I bet you that liberal, I don't care who you are, this cuts across everyone. And even if they had the chance, they wouldn't be able to stop it because it's surreptitiously coming in. So I can tell you guys, we're going to find a way to sue. Wendy, I mean, this is bigger than any of us. There have got to be lawsuits. We are looking now to see if anyone's been harmed. I want you both to know that we did have a parent come forward and say that because of the survey, her child was diagnosed with depression from somebody that will not reveal themselves, and that medication was suggested. So when this parent went to the school and said, what the heck is going on? The school refused to give the parent any information about who said there was a diagnosis of depression and who recommended. They refused to talk to her. So this is not good.
No, it's and another thing, Nancy, was we found out. So I'm being interviewed by our newspaper at 8, but and she's building the foundation of parents' rights, and then going into, because we know where it's going to lead, but like Sloan said, we don't have that proof quite yet, but we need to stop it and prevent it before it happens.
Yes. One is too many. One child victim is too many.
But the board was given a survey, but it wasn't the one that went to my child, and they approved not that one. And
that's what I was concerned about with the panorama, because I've been on that website and downloaded surveys, and they can mix and match questions.
And they can. It's a template. That's right.
Yeah, and they formulate whatever they want to get out of it. And they're various subjects. Exactly. And so when I was first learning about this, that's what made me the most concerned, is because they could tell a parent, well, we just signed up for, the basic one, like, do you like school? But meanwhile, you can insert a bunch of other questions.
That's if those few questions. I mean, literally. So a kid in Micah's class said, "What does other mean?" Well, let's just pretend my son is showing gay tendencies, and the kid, kind of laughed and said, "Oh, it must be the gay kids." well, then you've created a bullying situation in 7th grade.
Yeah. And that's the thing. I mean, all of our gay parents, and we've got many in this coalition, they're concerned about a couple things. First of all, they're concerned about the age inappropriateness of this. They don't like that, and they're afraid that people are going to blame them for it, and they have nothing to do with it. They're also afraid, now this is a very big problem, is that when you out a child or a person before they're ready, especially a child who's developmentally, not equipped, a 16-year-old who is gay and who's not ready. I mean, having the entire class being asked if they're gay, there's a lot of concern that we have for gay students. This is not healthy.
Right.
No.
So
it has nothing to do with, it's really mind-boggling. It's really, really very upsetting. This is
so someone asked, what do you mean by panorama or panoramic survey, Sloan? Do you want to explain?
Nancy, you're the resident expert on
panorama. I'm still learning. There are other people that know more about this than I do.
You're it, Nancy.
From what I understand, there's something called SEL, which is social emotional learning, which in some cases can be a legitimate exercise to approach behaviors in children.
Right.
Unfortunately, like everything else over the past few years, much of it has transformed, and it's becoming an industry kind of like the diversity, equity, inclusion industry, where it's projected to make up to $6 billion in a couple of years. And a lot of it is now incorporating this racial identity based progressive kind of agenda. So there's a group called CASEL, CASEL, and they're kind of the umbrella group standard, I think, is for a lot of these schools and states. Mm-hmm. And then they align with a company called Panorama. So CASEL sets kind of they have all these circle graphics and intersections of emotional and that stuff that, I was a surgeon. That's stuff that I'm just like, whatever, I don't care. But anyway, aligning all this stuff. And then Panorama does the surveys in line with CASEL's ideologies. And so you can go to the Panorama website and you can put in your information and download a sample survey and that type of thing. And they have several different categories, and there's several different pamphlets as well from CASEL about inequities in this. And they do have a page about culturally relevant training, and colorblind isn't a good way to approach things. And we have to be aware. I mean, they have cultural surveys, they have all different kinds of things. So when I was looking at the Panorama website and looking at these surveys, it worried me that, a legislator or someone from the DPI could say, well, we're not going to do this CRT based survey. We're just going to stick to this. But
that's right.
You can mix and match is from my understanding.
But I want to tell you what let me break it down, and you're not going to like it. When do you really? So when you're mixing equity with drugging our children, because that's what the SEL is doing. So it's called equity-based, and they say it, equity-based healthcare. Now, we do not just trust anyone with our children. And why the hell would we want to when they're doing this? So it's equity-based. The Board of Education and the DPI defines equity based on sex and race. That's how they define it. That's not me. That's them. We think of equity as developmental differences, background difference. That is not what they're talking about. When you're talking about health care without parental consent and equity, you have a real, serious, alarming crisis. That is exactly what they're talking about. Let's just say there is a guy like James Ford who is atop of the pyramid when it comes to making decisions around here in North Carolina. Black guy hates all white people, has said it, repeated daily, a couple times a day on Twitter. So if he hates white people, let's say a guy like that is teaching or administering these tests, what's to say that he doesn't pull children that are white aside, fudge their tests maybe, and then prescribe mind-altering drugs and ruin their lives? This is what we're talking about. Mm-hmm. Mental health clinics do not belong in schools to begin with. But when you have people, the reason why we don't trust you, DPI, we don't trust you with our children is because, first of all, you're covering it up, you're lying about it, you're getting other people to cover up for you, but you're saying equity in healthcare and schools belong in the same sentence. Here's how they define it, guys. race and sex, decisions should be made on that with your health care in schools without parental consent potentially. Wendy, they have said, we're going to let you know about the surveys. We're going to keep the parents involved. The lawyers admitted they didn't do that. We're hearing from parents across the state, everywhere. They are not letting parents know. Wendy, we already know a parent in your school said, please, principal, do not test my child. The principal said, okay, no problem. And the principal forced that child. So people are not operating in good faith, and we should not trust them with our children, period.
And in defense of that principal, the principal is hearing, you must do this. I mean, they know they're going to be with that rubric that where they're evaluated as an administrator, they're going to be marked off. Nope, doesn't push that, you know. I mean, and you said, I was thinking about it today, no child left behind. And I'm thinking, damn, if we aren't leaving children behind now. Well, I mean, in a different way, Nancy, you know, I mean, really, like, I used to worry about that. Now, that's nothing compared to no child left behind.
You mean no child's behind left alone. So, you know, we are really, we have 2 chapters in California right now, and we've been talking to parents for the last month about this. We are worse in California. We are worse in California. Children are killing themselves in California. Planned Parenthood officials are working in these clinics, and they're giving, you know why? Let me tell you why. You know, it's about the money. So let's just talk about a bit of business model, because we can all understand profit motive, right? So Planned Parenthood can make, I don't know how much on an abortion, I don't know. But they can make $600 per month per kid by having these hormone treatments. And I'm going to tell you something else. In DPI's own documentation, everybody's like, where can I find this? Where can I find this? You guys, I'm working on a piece right now. I promised you, I'll get it to you tomorrow, and I have all the primary docs for you. In the DPI's own literature, it says we are working on being able to be a provider of healthcare so we can bill insurance. That is terrifying.
The school system will be able to bill insurance?
Yes, yes.
Our own speech therapists can't do it by themselves. How are they?
Well, they're trying to do that. They're trying to do that. And so, you know,
one payer system, it'll be pretty easy, right? I mean, and everything will be all in one thing, and you'll have no choice.
Well, I mean, that's what it is. But look, I mean, we have no problem. In fact, I commend anyone and any, I commend the schools for trying to handle, mental health crisis because of the shutdown. But excuse us for not believing that crap. They didn't give a rat's ass about keeping the school closed. And with suicides, I actually have screenshots of many teachers laughing at kids killing themselves. Maybe they're white kids. I am not kidding you, North Carolina teachers. And so pardon us while we're cynical that all of a sudden we want to make every school one flew over the damn cuckoo's nest here.
Yeah, I was like, one of those bills referenced because of we want to increase the mental health services. And I said, well, that's written incorrectly because it wasn't COVID pandemic. It was the lockdowns and the teachers union advocacy, even at the national level of the CDC, that kept the schools closed and children isolated and all of that. So if you want to write a bill, at least be accurate and say it was the policies that led to the anxiety, not the actual virus. But that's, again, how they sneak this stuff in and they twist things, and they're hypocrites where they're using, some of these policies are at fault for these mental health issues. And then they're using that to justify more money to fund the very people who made these decisions in the first place. There's so many levels of wrong here. Just let the kids go back to school, give them challenging curriculum, be caring individuals, recognize kids that may be struggling, talk to parents, include parents, incentivize parents to be involved, be transparent, be open, and these, I don't understand why that's a difficult concept.
Right. And I want to point this out. You're exactly right. I want to point this out to everybody that's listening. We've gone over the budget with a fine tooth comb. And I'm going to tell you this, the budget request for recovering learning loss was $38 million. The budget request for equity and for putting a mental health clinic in every single school was $60 million. So look at the difference there. And on top of that, I'd like to add, they're also getting federal money for this mental health and this clinic stuff. They're getting an ton of money for this. And so from where I sit, they want to turn our schools into clinics. Not only, by the way, not only for students, but they talk about community health, as you pointed out, Nancy. So, or Wendy, you're talking about community health. They want to do it for everyone. And so, and again, I want to remind you, I would feel a little bit better, you guys. I don't know about you. If the informed consent age here was 18 in North Carolina, I wouldn't be having this conversation because I could sleep at night knowing that the kids would not be medicated without their parents involved. The age of consent in North Carolina is 0. You can get a vaccination. It's 0. You could get puberty blockers at 8 years old. The North Carolina, this is what makes me mad as hell too. The North Carolina General Assembly, the Republicans, they wrote a bill that would make it illegal to give puberty blockers to any child below 18. It might have been with parental consent. That bill was tabled. And boy, do we need it now.
And where's that, Sloan? Where'd you say?
That was tabled. That was not brought up. In other words, the bill was put out there and now it was not brought up. And so we have a couple of bills. We have a couple of asks. First of all, I reached out to a couple of our representatives today who were genuinely interested in the research that we had. Nancy, you and I are going to contact them. We're going to formulate a letter that is going to inform some of our legislators on what we're talking about tonight. I'm going to write and publish a piece tomorrow. I want everybody to share it with 100 people. You have to. Okay, that's another thing. We've got a few bills that we're talking about, and I think we're going to put together a legislative action day. Wendy, we talked about this as soon as 10 or 12 days from now, where we're going to talk to the legislators and let them know legislators are people, right? They need to be educated. Where we go sideways, Wendy, and Nancy, you know this too, is when they start lying. When not only do they not want to hear the information that's going on, they start lying. And so
some Republicans are behind one of these bills, which is very concerning.
Yeah.
Right. And so again,
identify those.
Nonpartisan issue. And we go, if you look at the org chart in the state of North Carolina, the only elected official that's really in the mix administering education would be Catherine Truitt. I mean, you've got Dale Falwell, who has a voting right on the school board, and you've got Mark Robinson. I don't think anyone that's listening in here does not trust Mark Robinson or Dale Falwell when it comes to protecting our children. Why? Because they talk the talk, they walk the walk. The only one of the three that is elected, it's Catherine Truitt. I'm sorry, but when you are responsible for this, your job is to act as a firewall to protect psychopaths from our children. She's not done that. So now we need to go to our legislatures and let them know that the DPI is completely broken. They are a menace to children and families in this state, and they need to be protected. The legislature is going to have to come in and be involved. Wendy, you hired a lawyer. We're getting lawyers. We're getting involved. There's 2 ways to get out of this. Wendy, you already know this, is you sue, which we don't want to do, or you have the legislators come in. We cannot have the General Assembly leading us to fend for ourselves.
So, Nancy or Sloan, so do you think their information, that the kids' information is going to be shared somewhere?
100%.
Like other than
I think you can go to the CDC. The CDC is already intertwined with some of the comprehensive sexual ed stuff, and some of their advisors I looked into tweet out some very questionable things. So I'm very concerned that this is going to be collected, and who knows? I don't know the laws with these private companies, but I don't want someone who is making money in this, in Pennsylvania or wherever, having information.
How about China?
Or China.
How about China? Because we know that the Oak Foundation that's based in the Channel Islands, right, out in France, and that they make their money in China. We know that at least one school district, get this, you guys, they're paying for these surveys to be given, full stop. They're paying for a person to interpret those results for 2 years. Why the hell would a foreign-based NGO pay for any school district to administer surveys, to interpret the data? If you think that they're not entitled to that information because they're paying for it, I think you need to get a reality check. Why is that being allowed? Why is any third party that has ties to China being allowed to do this? You know what, guys? I think what's going on is this is a social credit score. This, we do know, you guys, is going to stay with children. Their student ID is attached to their medical diagnosis. So what happens when the child is of age and wants to get a gun? What happens if the child is of age and wants to apply to a school and a school doesn't want someone that has had depression? What happens? How do you unwind yourself? This is the biggest overreach, and potentially, I mean, this is taking away the civil rights of children before they're actually of age to be able to do this. This is horrible. So, I mean, I can't stress it enough. So here are the action items. We're writing a story. I want all of you guys, if you have not already done it, actually, let me drop our address in here. You have to sign up for the newsletter. You have to show it everywhere. Primary documents, as always, will be attached. We do not want you to believe what we're writing. We want you to say, huh, and then check every single primary document that we link to for yourself, okay? And we want you to share it with 100 people. Don't know 100 people? Find a way.
So the CDC website has how the whole school, whole community, whole child model informs HIV, STD, and pregnancy prevention. And they have some of the same graphics as Castell/Panorama. And that's directly on the CDC website. So, I mean, I have to do more research into the connections and everything, but absolutely, this is going to be collected by federal government.
Right. And we know that the CDC has come out with some crazy stuff lately. They've been just plain wrong and hidden that on a lot of things. But the CDC has also said they're taking an equity approach to giving vaccinations, for instance. I mean, you know, that's not a scientific rationale, right, Nancy? This is treating people based on their skin color. Mm-hmm. We don't want children treated differently based on skin color in their education. We sure as hell do not want it for Black or white children. I mean, we don't have to go back in time for sterilization, right? We remember eugenics. You remember the Holocaust was started by doctors and nurses. I mean, that's how it started with them. I mean, this is not hyperbole at this point. This is an alarming turn of events, a massive cover-up. And in your case, in Pitt County, everyone from the principal to the school board to the parents have been hoodwinked by the DPI and the state school board. And I'm going to issue this challenge right now. I want every journalist to dig into what we're saying tonight. Mm-hmm. I cannot be the only journalist exposing this stuff. That ends tonight. So I am imploring you, whatever your feelings are about whoever we've been talking about, I am begging and pleading for help in investigating this information and getting it out to the public. So if you are listening, or if you know somebody, won't you join us? Won't you expose this with me?
I appreciate it, because I couldn't do this by myself.
No,
you're not alone.
No,
you're not alone. But we need help, so we're asking for help. And so anybody of good conscience that wants to join our movement, and anybody that is able to do investigative journalism, I'm one person. We need a lot. There are a lot of journalists out there that are writing about stupid stuff about school board and this and that. This is very serious, and so we need all the help we can get. So, Wendy, I want to thank you, and we're going to say goodnight to you. And Nancy, right. We're going to stop and then start another one. So I want to thank all of our people out there. We ask that you share this broadcast with everyone. We ask that you sign up for our newsletter. And again, any and all help that we can get, please donate also. We're putting together lawsuits. We are helping children and parents and teachers that are having their human rights trampled because the government's clearly coming after us. So, so I definitely want to thank you guys and have a good evening and share. All right.
Thanks, Nancy. It was nice meeting you.
Yeah, you too.
All right. Bye. Thank
Good night.
you.
Bye.